So today we are going to talk about the origin, insertions of the muscle, the fascia if any, the ligaments of the iliac crest, ilium, of the ischium and of the pelvis. Okay. So now you can see this iliac crest. In the very beginning of the introductory video for hip bone of 18 minutes, there is a video of hip bone, introductory video. Without watching that video, don't come to this content because it's huge. Now, I told that hip bone has mostly origin. As we, rotate our eyes to the hip bone, it's all about origin. It's red, okay, completely red. Red signifies origin. Single muscle insertion is external oblique muscle. Constantly say erector spinae because there is an origin for erector spine in the posterior 1/3. I would say that. So this, first of all, what we are going to talk about would be the iliac crest, which extends from the anterior superior iliac spine to the posterior superior iliac spine. এই হলো iliac crest. এই যে বড় পোর্শনটা, this is the anterior 2/3. আর এই ছোট পোর্শনটা posterior 1/3. এই anterior 2/3 এর outer middle inner lip এর origin of tensor fascia lata insertion of external oblique and inner lip origin of the latissimus dorsi. Posterior 1/3 origin of the two muscles, that is your quadratus lumborum, and this one is for the posterior 1/3, the anterior 2/3. ঠিক আছে, so that is all about the iliac crest. Now let us talk about the ilium bone, the iliac fossa. Here you have the iliac fossa. Again, I am recapitulating the iliac fossa, where there is an origin of the iliacus muscle. This is the sacropelvic surface. Here are certain ligaments that we need to remember. And what is important will be the gluteal surface. What is it? The gluteal surface. Okay, posterior 1/3, there are two muscles. One will be the quadratus lumborum, another is the erector spinae, both origin. These are all abdominal muscles, hence in lower limb you may not come across these names. What we are going to read is the gluteal surface of the iliac bone, the iliac fossa, and the sacropelvic surface. একটা auricular portion দেখতে পাচ্ছি এখানে, the ligaments will be there. So let us discuss this one by one. We will spend a lot of time in the ilium itself. And the lower part of the ilium bone contributes to this rounded part, and the name of this part, pause the video and try to recall, that is, this is the acetabulum, which will definitely engulf the head of the femur, right, forming the hip joint. ঠিক আছে, তাহলে let's talk about the gluteal surface and the iliac fossa and the sacropelvic surface, the iliopubic eminence, তারপর একটুখানি obturator foramen, and slowly the ischium, the pelvis, and the ischiopubic rami. Please do refer to the first video, because without the first video, just simply rote learning the origin insertion will have no use. Okay? First, let's understand the gluteal surface. Go back to the last video and read what are the posterior, anterior, and the inferior line. Is a posterior, anterior, and the inferior line. It all meets at the root of the greater sciatic notch. The greater and the lesser sciatic notch becomes the foramen. এই যে নচটা যেটা ধরছি আমি while holding this one, there's a greater sciatic notch and there's a lesser sciatic notch which becomes a foramen due to the passing of the sacrotuberous sacrospinous ligament. Ligaments, again, very important. Here we have the huge origin of the gluteus maximus, medius minimus. ঠিক আছে, above the posterior, above the anterior, above the inferior line, the origin of the gluteus maximus, medius minimus. Refer to the previous video to understand the lines. Then we have this, the posterior superior iliac spine, posterior inferior iliac spine, the ischial spine, the greater lesser sciatic foramen. This will be wound around by the pudendal nerve, the internal pudendal vessel, the nerve obturator internus. Just go and refer to the other video where I have said the contents of the GSN, the greater sciatic notch. Anterior superior iliac spine theke there is inguinal ligament, posterior superior iliac spine theke there is this iliofemoral ligament and the straight head of the rectus femoris. Coming to this concave depression that you have is for the origin of the iliacus muscle. The auricular surface will articulate to form the sacroiliac joint আর উপরে যে tubercle আছে এখানে আমাদের iliolumbar ligament, the dorsal sacrospinous ligament, interosseous and the dorsal ligaments are present in this region. আর এই যে একটা grooved area সেখান থেকে tendon of obturator internus will be present and the auricular surface will form the sacroiliac joint. You have the formation of the hip joint out here. So দুটো জয়েন্টের ব্যাপারেও জানলাম. So in the Viva table the question might be the formation of the hip joint and the sacroiliac joint with the sacrum. So tell me the type of joints formed by this hip bone. The answer should be the sacroiliac and the hip joint. Okay. Now let us slowly move on to this portion where you sit, that is the ischium, and which part you sit that also will be discussed. Let's talk about the origin of the ischium. যখন ischium পড়বো তখন we will see that there will be an upper quadrangular, lower triangular, the superolateral medial, inferolateral medial surfaces for the origin of the adductor longus magnus brevis. And I think as far as I remember that is the short head of the bicep femoris might origin from the inferolateral or superolateral part. Let us have a discussion on that, and then let's have a discussion on the ischiopubic rami, the pelvis and the obturator foramen. ঠিক আছে? Then we will end the hip bone. So let's now discuss about the ischium. Now there is a horizontal line having an upper quadrangular, lower triangular, upper quadrangular, superolateral, superomedial থেকে semitendinosus from the superomedial part, semimembranosus from the superolateral part, lower triangular for the adductor magnus. এবার lateral border, anterior border থেকে the tendon of the obturator externus and lateral border obturator membrane থাকবে. যখনই আমরা posterior border যাব একটা ischial spine যেখানে coccygeus and levatorinae and the sacrospinous ligament forming the lesser sciatic foramen. This is the ischial spine, again the pin structure is passing through this. So this one is the posterior border, anterior lateral border, the entire, and the lower part has a fibrofatty tissue for the sitting position, the lateral part of the triangular region and medial part for the sitting position. Now let's discuss about the conjoint ischiopubic rami. ওখান থেকেই we will have the, I am just briefing you, we will have the adductor longus magnus brevis. Okay, and the adductor head of the adductor magnus is again, adductor magnus has two heads, one will be in the tibia and other is here. Adductor magnus এখানে আছে, adductor longus brevis magnus, the fibers will continue like this. Lower part থেকে gracilis থাকবে, and here you have the obturator internus. Okay, the uppermost is obturator internus, lowermost is gracilis, তার মাঝে থাকবে adductor longus brevis. That is your conjoint ischiopubic rami. Rami is a bone like a bridge which connects two parts, that is the pubis and the ischium, hence it's called the ischiopubic rami. ঠিক আছে? So that is the ischiopubic rami. Let's talk about the pelvis up next, and then the surfaces and all those stuff. Now more words on ischiopubic rami. That is, যখন আমি বাইরের দিকটা ধরছি, there is an upper border, lower border. The obturator membrane is there in the upper border, lower border is sacrotuberous ligamental lowermost extension. যখন আমি এদিকটা করছি তখন there is an upper area for the obturator internus muscle. There is a middle area and the lower area. So that is how there are ridges rather, upper, middle and the lower areas and the ridges in this part. So apart from these things, these are the basic stuff you need to know about the conjoint ischiopubic rami. Now let's see the muscles from the upper, middle and the lower ridges on the inner aspect. Where? Now, the angle between the symphysis pubis and the pubic crest, you have the origin of the adductor longus. Then you will have the, as you move there is this outermost, is extending more towards the ischiopubic rami, will be the gracilis. এই যে বড় জিনিসটা এটা হচ্ছে আমাদের, sorry, from here this will be the obturator externus muscle, also a part of the ischiopubic rami but more towards the pubis, and this one has been the obturator internus. এবার this ischiopubic rami has a lateral part and a medial part. The ischiopubic rami a lateral part and medial part. In the lateral part there will be the pectineus muscle, ligament, the fascia, and the medial part will have the fascia transversalis. Okay, so that is the lateral medial parts. ঠিক আছে, তাহলে that is your pubis, the ischiopubic rami and the ischium, the ilium. এটা দেখলাম. Now let's talk about the obturator foramen and the acetabulum. Let's talk about the obturator foramen, which is turned into a canal by the obturator membrane, which is in the periphery, forming it a canal. And this one is triangular. I think it's the male hip bone, and in case of female it's circular or oval in nature. It's oval in nature. That's all about your obturator foramen or canal. Now this depression is acetabulum. Acetabulum, the 2/5, 1/5 by the ilium, ischium, pubis. Acetabulum e acetabular fat pad থাকবে lower part এ, lunate surface is articular surface with the head of the femur. The acetabular notch আছে একটা, এবং এই গোটা portion একটা transverse acetabular ligament will deepen the entire cavity. And one thing is, here you have the origin of the two muscle. Actually, majorly from the ischial spine is your coccygeus muscle. Actually, your levator rani is pubococcygeus and the iliococcygeus. So levator rani is like this. In those two portions is the levator rani, making it the true pelvis and the false pelvis. Above, true pelvis, below, false pelvis. ঠিক আছে, because below it's the content of the perineal part. So that's all about, and just above the acetabular notch you have the reflected head of the rectus femoris. These were certain things I missed out. And this particular pubis has a pelvic part as well, pelvic surface. এখানে আমাদের medial side there is a conjoint tendon and the lacunar ligament as well. ঠিক আছে, and yeah, so that's all about the various origin insertions and ligaments of the hip bone. Hip bone, whenever they're asking, they will be more interested with the ilium part, the ischium part, the ischiopubic rami, and this one. Acetabulum is more of this part. You will read the labrum, which is deepening the cavity surrounding the acetabulum, another thing. So a number of things needs to be said for the hip bone. I've covered the surfaces, the borders of the ischium, ilium and pubis along with the acetabulum in the first video, along with the iliac crest. Please do check it out. And then read the origin insertions of the muscles. Origin mostly, because there is only one insertion and they will ask you this question. The only insertion is of the external oblique muscle and abdominal muscle in the anterior two-third middle part of the anterior two-third of the iliac crest in front of the iliac tubercle. There is this iliac tubercle, এই যে দেখতে পাচ্ছি. You can easily identify it in the anterior two-thirds. So the only insertion, rest all origin and the ligaments. এবার যেটা একটু দেখতে হবে, that is ossification, and two joints we read. There is a sacroiliac joint in this auricular part, and definitely the hip joint with the lunate surface of the acetabulum, the articular surface. এই দুটো joint আমরা দেখেছি for the hip bone. এবার আমরা যেটা দেখব, that is ossification of the hip bone, the fractures of the hip bone. That is a clinical part. Okay, so the last one is ossification. You have total 8 there are 111 ilium, ischium, pubis, primary center. Age of appearance, 2nd, 3rd and 4th month of the intrauterine life. Age of fusion, 18th. Puberty তে appear করবে, fuse by 20 to 25th year. 2 for iliac crest, 2 for the Y-shaped acetotubular cartilage, and only 1 for the ischial tuberosity. And they are going to fuse at the age of 20 to 25 years, will appear at the puberty. So that's all about the ossification. Fracture of the hip bone is something we read along with the hip joint. And what is asked is a fracture of the femur bone. Okay, hip joint dislocation is more asked. So দুটো joint formation সবসময় মাথায় রাখতে হবে, the articular surface, the hip jointer, আর আমাদের sacroiliac joint, the auricular surface. এই জিনিসটা মাথায় রাখতে হবে, ligament গুলো জানতে হবে, and the basic origin that I have stated. So that's all about the hip bone. And please do refer to the first video, that is the orientation part, that is where I have discussed the anatomical position and the side determination and the points of that. Clinical এখানে খুব একটা কিছু নেই. Hip joint, when you read, that is a very important joint, lot of questions from the hip joint. ওটা একটু পড়লেই হবে, আর বাকিটা আমাদের femur fracture is asked, also the ossification. Hip bone ossification ভীষণ easy. 3 primary centers from ilium, ischium, pubis fusing by 18th year of the life, and the origin at the 2nd, 3rd and 4th month of the intrauterine life. At the secondary center gulo 2, 2, 1 for the the articular cartilage, Y shape with the ischial tuberosity and the iliac crest, 1 for the ischial tuberosity and 2 for the iliac crest. Again, beginning the ossification from the puberty and ending it by 20 to 25th year of the life. So ossification খুব একটা tough না, femur ossification জিজ্ঞেস করা হয়. So I have again kept the base of the skull in order to build up the interest slowly. So one day when we complete the bones of the lower limb, I would move to the bones of the head, neck, face. And the first bone I would start will be the base of the skull. The video will be a little later on, because we have just completed the hip bone, and then we move on to the femur, followed by the tibia, fibula and the articulated foot. I will give a pictorial representation for describing it. And then actually we move on to the bones of the head, neck, face, followed by all the vertebrae and the ribs, because along with the sternum, because they are the bones of the thorax, and thorax or the abdomen are visceral area. So for that area, the vertebrae are most important, the first, second rib, they are typical, atypical ribs, but more important will be the viscera. So I would even like to discuss the viscera of the abdomen and the thorax, that is heart, lungs and the abdominal portion, if there is a request or there is a demand, not a request, a demand by the public. So I may discuss it, but at the end of the lower limb infex bone, we are going to primarily discuss the base of the skull. And what I feel interested about the base of the skull is the inner portion. And if you look at the inner portion, there is so many depressions present. Inner part এ গেলে ভীষণ সুন্দর অনেক depression দেখা যায়, এবং lots of foramen. In simple English, it is hole. Okay, so the foramen and the nerves that pass along with the artery and the vein, that is what makes the base of the skull interesting. তো এই ব্যাপারটা দুটো অরবিট ধরে আমি টানাটানি করছি. Constantly I'm moving it via the orbits, and this, not the orbits, this is the mandibular crest, something like that. So the orbits are in front, where you have the eyeball and a lot of other things. So that is something I'll discuss in the head, neck, face to develop the interest that this bone will come one day. And for this bone, I won't say it's very tough, but the bone here has a lot of foramen, and for that we need a detailed orientation. So just like the hip bone, this bone is also very tough. Yeah, so tomorrow we again move on to the very classical long bone. In the Viva table, I feel the femur and humerus are very common, and when all the bones come together, Definitely we should not do it because femur is very long when compared to humerus. But I feel sometimes the students, what they do is they, in hurry, in nervousness, in anxiety, they have, studied the entire night, and then this anxiety hits them. And they might confuse these two bones. So tomorrow femur would be mostly like humerus. It's an easy bone, long bone, because we have already discussed long bone. Tibia, fibula, very short videos will come, because tibia is the shin bone, it can be palpated along your medial side of the leg. So shin bone, okay, because the interosseous border of the tibia is called the shin, and fibula as well, not much. Fibula, the borders are hard to differentiate, but again, according to the compartment of the leg, I will discuss it. There will be the insertions of the muscle. তারপরে তো articulated foot, ওখানে আবারও যেটা প্রবলেম সেটা হচ্ছে you have to understand the tarsals, metatarsals and phalanges. খুব একটা টাফ কিছু নয়. Just the details of the bones are present. I will give a pictorial representation and discuss it by sharing the screen, not a classical video like this. So that's the orientation of how we go for the lower limb bones, because hip bone is partly the pelvis perineum, partly abdomen, partly lower limb. তাই hip bone is a tough bone. It's an irregular flat bone, it's a tough bone. কিন্তু যখন আমি lower limb, typical lower limb এ ঢুকে যাই, bones are not very tough. The femur is not tough, tibia, fibula very easy. Fibula যেটা করতে হবে, that is to demarcate the borders. Sapori, it's very easy. Our articulated foot, pictorial representation along with the details on the various tarsal bones, যাতে কোনো রকম ফিচার ডিস্টিংগুইশিং মানে প্রবলেম না থাকে। আর that's all about the how we go with the typical lower limb bones, which actually starts with the femur, and keep on building the interest for this grand, beautiful bone that is the base of the skull. So today's video ends here, and again, it's a humble request from my side. Please do like, share and subscribe my channel.